My name is Aaliyah Staten, and I will be assessing my patient today, Carolyn Staten. I'm going to start by assessing her scalp and her cranium. There are no lesions, no bruising, no scrapes. Her face is symmetrical. Okay. Look forward, please. Oh, look forward, please. Okay. Her pupils are equal. They're round and reactive to light. Open your mouth, please. Her mouth is pink and moist. There are no scrapes. Let me see your teeth. Okay. Her teeth are normal. Are you missing any teeth? Okay. How many teeth?
2.
Okay. Let's see. I'm gonna look at her ears. There is no drainage. There is no lesions. Okay. No drainage or lesions in both ears. Now I'm gonna palpate her nose. There any tenderness in that? Okay. Can you take one hand and press down on your nostril and breathe through the other side? Okay, and do the same for the other nostril. Okay. They're pain. Did you have any problems with that? Okay. I'm gonna get you to smile, please. Clench your teeth. Okay. And do that again. Okay, she was able to do that with resistance. I'm going to get you to puff out your cheeks. Okay. Smile, frown, raise your eyebrows, close your eyes tight. Let's see. Okay, you can open them up. All right. And I palpated her mandibular. Okay. I'm gonna check her sinuses now. I'm gonna check her maxilla, her frontal and her maxilla sinuses. All right. Were they tender?
Yes.
Okay. Let's see. Now I'm going to assess her lymph nodes. Preocular, postocular, submental, mandibular, post-cervical, pre-cervical, deep cervical, and supraclavicle. And I didn't feel any nodules or any. Did you have any tenderness with that? All right. So I'm inspecting her neck. It's symmetrical. I'm going to test her thyroid function right now. I don't have any water, but I'm going to get the patient to swallow. All right, and try to take a big swallow. All right, good. I felt that, and it was symmetrical when she swallowed. Do you have any thyroid issues?
No.
Okay, good. I went over her cranium, her scalp, her nose. Now I'm going to go over her eyes. I'm going to inspect her conjunctiva. They're pink, they're moist. Her sclera is white. Do you have any eye issues? Okay. Do you wear glasses?
No.
Okay. Now I'm going to get her to review this Snellen chart. If you would just stand up for me, please. See if I can. All right. I'm going to ask you, I got her at least 10 feet away from this chart. I'm going to have you close one eye and read the line that you think you can see farthest to the bottom. You want to start right here?
Yes, that's F, Z, D, F, D.
Okay.
L, P, L, D.
All right. Uncover
Easy.
that I, and then try to read this.
D, E, P, L.
Okay, and uncover that I and cover the other I again for me.
L, F, E, D.
Okay. Now try to read with both eyes.
D, E, F, L.
Okay. Her vision is 2063. You can have a seat. All right, and you don't wear any glasses or contacts, correct?
Correct, but I mean.
Okay, so I went over her scalp, her eyes, her nose, her mouth, her ears, her neck, which is symmetrical. Now I'm gonna listen to her. No, I'm gonna test her cranial nerves now. I want you to take your ear and put it on your shoulder. Do the same for the other ear. I want you to touch your chin. Okay, and raise your head back. Okay, good. Let's see. Now I'm gonna check her gag reflex. I'm moving the camera because I have to walk over here and get something. All right, so I'm gonna get you to stick out your tongue for me. All right, now I'm gonna take this. Okay, all right, her gag reflex is pretty good. I'll just sit this right here. So I want to check the range of motions in your arms. Can you take your arms and put them forward? And this, flip them around this way. Okay, now flip them around that way. Now you can put them to your side. Bring your arms out. Bring your arms back. Okay, good. Now I want for you to flex your arms. Flex your arms. Okay. I'm going to test you to do it against resistance. So try to push me back. Okay, good. I want you to take your fingers and see if you can make your thumb touch each finger. Okay, good. Now fan them out. All right, and twist your wrists. Okay, good. So I checked all of your range of motions. I'm going to listen to your chest sounds, okay? But I'm going to do this on her posterior side. So if you will kind of turn towards that way, I'm going to listen to your back. I'm going to have to pull up your shirt though. Okay. Can you hold that up for me? And turn a little bit more. Let me turn this chair a little bit so they can see. Okay. Turn it a little bit more. Okay, good. So first I'm inspecting her back. She doesn't have any bruises or lesions. She doesn't have any sores on her back. Now I'm gonna check for freppatus. So I want you to say 99.
99.
Say it again.
99.
Say it again.
99. 99.
Okay. Now I'm gonna percuss her back. Okay. I'm gonna palpate it. you have it? I'm gonna hit your flank area right here and let me know if you have any pain. Any pain? Okay. Now I'm gonna listen to her lung sounds. Take deep breath in and out. Okay. Good breath sounds. Her lungs are clear. I'm gonna get you to turn around for me. Now I'm gonna listen to her chest sounds. I'm gonna listen to her heart. I'm listening to the pulmonic. The aortic, and I do hear S1 and S2. The mitral, the tricuspid. Okay, I'm sorry. I have to. And the mitral. Okay. We listen to her lung sounds. We listen to her chest sounds. We listen to her chest sounds. Now, I'm going to palpate her chest. Make sure she doesn't have any nodules or lumps there. I want you to hold out your arm and relax it. I'm going to check her tricuspid. Not tricuspid, triceps. I'm going to test her reflexes. Yeah. Her triceps did jump. And relax your arm. Her biceps did jump. And I'm going to try her brachial reflex. Her thumb jump. I'm going to do it on this arm. Relax your arm. Okay, her triceps jumped. Her biceps jumped. And relax your arm. Okay, and her thumb jumped in her brachial. We tested out on her head. I need to feel for her temporal arteries. I did not do that. Okay, they're symmetrical. I want to feel her radial pulses. Okay, they're symmetrical. I'm going to feel for her brachial pulse. They're symmetrical. And I want to feel for her carotid pulse. They're symmetrical. I want to listen for a bruit on her carotid. Okay, I didn't hear any swishing sounds, so that's good. On her arms, I want to palpate her arms to make sure I don't feel any lumps. I don't see any lesions. Okay, I want to check her capillary refill, and it's less than 3 seconds on that hand. Less than 3 seconds on that hand. Okay, are you comfortable?
Mm-hmm.
All right. So we assessed her scalp, her face, her nose, her eyes, her mouth, her ears, her lymph nodes, her chest, her arms, her posterior chest. Now we're going to move down to the abdomen. So what I'm going to have you do is lay down. Well, first, before she lays down, I want to check for her, I can't think of the name of it, the graphisthasia and the sterignosis. Okay, so what that is, I want you to close your eyes. And this is the sterignosis. Open your hand for me. Okay, I'm going to place this in your hand. Don't open your eyes and tell me what it is.
That's a quarter.
Okay, good. Let me see your other hand. Tell me what that is.
A penny.
Okay, perfect. Now I'm going to trace a number in your hand and just let me know what that is.
8. 6.
Okay. And that was the graphisthasia. I'm going to keep your eyes closed for me. I'm going to place this against her face, and I want you to tell me what that feels like.
A soft touch.
Okay. What does it feel like? Well,
Cardboard.
Soft touch is good enough. Okay, keep your eyes closed. What does that feel like?
A light touch.
What does it feel like?
A Q-tip.
Is it soft or sharp?
It's sharp.
Okay.
That's a sharp.
Okay. How does that feel?
Like a brush.
Okay, well, soft or sharp?
Soft.
I'm going to do the other arm now. Soft or sharp?
Sharp.
Soft or sharp?
Soft.
Okay, good. Okay, you can open your eyes now. So now what I'm going to have her do is lay down on the couch. I'm going to assess, inspect, auscultate, and then palpate her abdomen. So I'm going to have you lay down on the couch, please. Okay. All right, so I'm going to lift up her shirt. You can lift up your shirt. Can you put your pants on just a little bit? Okay, perfect. So now I'm going to inspect her abdomen for any bruising or any lesions, any scarring, and she doesn't have any. Now I'm going to auscultate for her bowel sounds. And while I'm at it, I'm going to listen to her arteries, her renal and her aortic arteries. Okay, she does have bowel sounds in all 4 quadrants. Now I'm going to listen to her renal artery. And her aortic artery. Okay. And earlier in the video, I palpated her carotid artery, and that was a regular symmetrical, a regular rhythm. It wasn't bounding. I just thought about it. Okay. So Now that we have inspected and auscultated her abdomen, I'm gonna palpate. So lift up your shirt again for me, please. Let me know if you feel any tenderness. First, I'm gonna lightly palpate. Now I'm gonna do deep palpation. Any tenderness? Okay. She says she doesn't have any tenderness with that palpation. Now I'm gonna palpate her liver to see if it's engorged or if it's tender. And that's gonna be under the rib. And I don't feel her liver, so it's not engorged. And are you tender there? And she's not tender. Okay, you can lift down your shirt. So I inspected her abdomen. I inspected her upper extremities for symmetrical strength, which they were symmetrical. For capillary refill, her reflexes. Now I'm going to inspect her lower extremities. So what I'm going to do is pull up your pants, make sure you don't have. Okay. Do you have any sores or anything? She doesn't have any sores on her legs. Doesn't have any sores on these legs. I'm gonna get you to take off these shoes too. That's fine. Okay. I'm gonna assess for her pulse and her popliteal, her dorsalis pedis, and her posterior tibial. Okay. Now we get to their knees. Okay. Okay, and her popliteal pulses are equal. They're regular in rhythm and they are symmetrical. Her posterior tibialis, they're symmetrical and they're regular. It's not bounding, but it's like a normal pulse. And her, I'm gonna feel for her dorsalis pedis. They are symmetrical and they are regular. Can you lift up your leg for me? Can you lift up the other leg? Okay, can you move your feet forward and back? Okay, can you wiggle your toes? Okay, can you push my hand back? Can you push it forward? All right, good. So, we inspected her feet and her legs. They're symmetrical. What I'm gonna do now is test her reflex in her knee. So, you can sit up. And you can sit in this chair. All right. So I'm just gonna tap her knee. It'll probably be better if you sitting up because your feet touching the floor. I don't have a higher chair. Let's see. Kind of hold your leg. Yeah, hold it out. Let's see what it do. That one did it. Okay. So her feet did kick up. It did have a reflex to this reflex hammer. Okay, so now what I want you to do is take, can you stand up? Take one leg and bring it up your shin. Okay, there you go. And do the other leg the same way. Okay, there you go. All right, I want you to close your eyes, put your legs together, and hold your arms out and bring your leg up. Okay, do the other leg. Okay, good. Do you think you can hop on one leg? Okay, now try the other leg. There you go. You did it. All right, you can open your eyes. Okay, so we tested that out. Do you think you can bend over, bend forward? There you go. All right, you can stand up now. Can you bend back? There you go. Can you bend to your side and bend to the other side? All right, that's good. So you can take a seat now. I'm just gonna do an overview of everything we did. We assessed her head, her scalp, her cranium, her eyes. We assessed her nose, the patency of her nostrils. We assessed her ears, her mouth. We assessed her neck, her lymph nodes, her upper extremities, her heart sounds, her lung sounds, her abdomen. We inspected, auscultated, palpate. We didn't percuss her abdomen though, so I'm gonna do that really quick while she's sitting down. If you can you lift up your shirt, please? Okay. Okay. We percussed her abdomen. And I didn't hear any dull sounds or anything like that. So we listened to her stomach. We checked her arm reflexes, her capillary refill. Her back didn't have any lesions on it. Her legs. We assessed her lower extremities. We assessed her reflexes in her knees. She doesn't have any lesions, scrapes, or bruises on her legs. We assessed her dorsalis pedis, her posterior tibial, and her popliteal pulses. And we assessed her carotid pulses, temporal pulses, her radial pulses, brachial. And I do believe that that is the conclusion of our physical assessment, but I'm going to do some some patient teaching because my patient has hypertension. So, Miss Staten, what type of medicine do you take for your hypertension?
I take Losartan.
Okay, and I do have... Okay, that losartan is an ARB, which is an angiotensin 2 receptor blocker, and they help to relax your blood vessels. So it's important for you to take that medication as prescribed. How often do you go to the doctor to see about your high blood pressure?
Once a month.
Okay, well, good. So just make sure you take that medicine as prescribed. And I do have some papers here for you to read over if you would like to. I highly encourage you to do that. But in the meantime, as well as taking your high blood pressure medicine, there are alternative ways to bring down your blood pressure. You could eat a healthy diet, eat more vegetables. Don't try to stay away from a lot of pork. Let's see. There is this thing called the DASH diet, which is a substitute for salt. Do you like salt? Well, we'll have to cut back on the salt. That's a very important factor that contributes to high blood pressure. So I have some instructions on this DASH diet, some examples that you could use from the DASH diet would be poultry, fish, some low-fat foods, some potassium, stuff high in potassium like dark green leafy vegetables like spinach or collard greens. Just don't add a lot of ham hock in it or neck bones. Let's see. And it's also good to maintain a healthy weight. So maybe exercising at least 30 minutes a day, 3 times a week would be great. It'll help maintain your weight. And let's see, limiting alcohol. Do you drink or smoke?
Yeah.
Okay, well, you don't have this problem. So, but just to let you know, alcohol and tobacco, it can contribute to high blood pressure. So if you do decide to drink alcohol, drink it minimally. And don't smoke tobacco. You said you don't, so that's good. Let's see, do you feel like you have a lot of stress? No. Okay. Well, stress is also a contributor to high blood pressure. So you can find some ways to bring down that stress or to cope with it by doing some relaxation techniques or finding a hobby or something that you like to do to take your mind away from that stress. Maybe just by listening to music or singing or sitting outside listening to the birds chirp. Okay, and it's also important for you to monitor your blood pressure at home. Do you have a blood pressure cuff monitor? Okay, good. So just make sure when you feel, kind of funny or it's about time for you to take your blood pressure medicine, you want to see what that is. You want to see if it's high or low before you take your blood pressure medicine. Let's see. And like I said, these are just some papers that are here to remind you of some ways to help with your high blood pressure. So, supplements also lower your blood pressure, like omega-3 fatty acids, fish oil or flaxseed. Folic acid also helps too. So you can get some of those supplements, and fiber, wheat bran, that will be good for you as well as helping you have a bowel movement. Let's see. So we got you taking your medications properly, scheduling regular doctor visits, and adopting healthy habits and managing your stress. Those are the main ones that we need for you to make sure you take care of. Okay, Ms. Staten, do you have any questions for me?
No, ma'am. You've been very helpful.
Well, thank you.
Yes.
Let's see. Well, this concludes my video, and thank you for watching. And here is my MUWID.